Okay. Hi, I'm Thangam, and I'm a gastroenterologist. I'm faculty at the Medical College of Wisconsin, and my area of interest is something called cyclic vomiting syndrome, and we have a poster here on it. Cyclic vomiting syndrome, or CVS, is kind of the new kid on the block, I guess, but unfortunately it's often unrecognized, and we've done some work on this. Essentially, CVS is a chronic GI disorder. It's characterized by recurrent stereotypic episodes of vomiting, and people are actually normal in between. It's frequently undiagnosed. It's more often seen in Caucasians, and we did a retrospective study of one of the largest cohort of patients in the US so far. So we have, I have around 150 patients in my database in MCW, and there are various clinical characteristics of these patients. Like I said, many of them seem to actually present after 18 years of age. It is somewhat similar or analogous to migraines, and there's a connection with migraines. And people often visit the ED frequently. There's an increased rate of hospitalizations, and there's a marked delay in diagnosis. As you can tell in my poster, the median delay in diagnosis is about 4 years. So they often puke, they go to the ER, and they're actually told they have their 10th bout of gastroenteritis. And unfortunately, another unfortunate problem with this condition is that about 20% of these patients actually undergo iatrogenic procedures. And I'm not talking about just simple endoscopic procedures. I'm talking about surgery where they lose their gallbladders, they have either a cholecystectomy or appendectomy for their symptoms, and obviously their symptoms don't improve with it. The good news is that tricyclic antidepressants, they say old is gold, and tricyclic antidepressants actually work pretty well for this condition, and about anywhere between 60 to 75% of these patients respond to medications, which are actually very inexpensive. And so really the goal of my research is to highlight this condition, and there's a lot of new research going on, and in terms of the pathogenesis and diagnosis of this condition, and even possibly a genetic basis for this disorder. So yeah, we do have. I do work with CVSA, which is a voluntary organization, and it's a nonprofit group, and they do have a booth here. So I encourage you to visit their booth, and also the website if you want more information. Thank you.